I'm a pharmacist, and Ozempic has changed more about my day-to-day job than almost anything else I've dispensed in years.
A poisonous lizard, a hormone that lasts 4 minutes in your body, and a drug so in demand that patients with diabetes couldn't find their own medication. This is the true story of how a routine diabetes treatment completely broke the internet and became the most talked about drug on Earth. And it starts with something you've probably never heard of. Stick around, because the reason Ozempic works has nothing to do with what most people think it does. Every time you eat, your gut quietly releases a hormone called GLP-1. Its job tells your pancreas to release insulin, slows digestion so you feel full longer. Simple, elegant. Your body's already doing this right now. So scientists had an idea. What if we could bottle this and use it as medicine? There was one massive problem. Natural GLP-1 self-destructs in under 4 minutes. It's gone before it can help anyone. So the hunt was on for a version that could survive.
Think about that. You can't treat a chronic illness like diabetes with a molecule that vanishes in 240 seconds. We needed something that could actually stay in the system.
And that hunt led scientists somewhere nobody expected. In the early 1990s, researchers were studying the venom of the Gila Monster, a lizard from the deserts of the American Southwest. Inside its venom, they found a molecule called exendin-4. It acted almost exactly like GLP-1, except it didn't break down in minutes. It lasted.
It sounds like science fiction, but this lizard only eats a few times a year, so its metabolism is incredibly efficient. That venom was the blueprint we needed.
That single discovery kicked off an entirely new class of drugs. Fast forward a few decades, and Novo Nordisk scientists engineer a version that lasts an entire week. One shot instead of daily injections. They called it semaglutide. We call it Ozempic. In 2017, Ozempic was approved for one reason only: type 2 diabetes. It worked. Blood sugar improved. Patients were happy. But doctors started noticing something they weren't looking for. Patients weren't just managing diabetes, they were losing weight, a lot of it.
As a pharmacist, I find this fascinating. Some of the biggest breakthroughs in medicine happen because doctors notice the unexpected, not because they were searching for it.
That side effect is about to turn into a $100 billion industry, and a global shortage that hurt the very patients who needed it for diabetes in the first place. Here's where it gets wild. Clinical trials confirmed it. Semaglutide reduced appetite and helped people eat less, consistently. Then celebrities started talking, then influencers. Then it wasn't a diabetes drug anymore. It was a cultural phenomenon. Demand didn't just increase, it exploded. And that created a real problem. Semaglutide isn't like a normal pill you can mass produce overnight. It's a complex peptide. Manufacturing it takes specialized labs and serious time. So while the world scrambled for Ozempic, people who actually needed it for diabetes couldn't find it.
This part isn't abstract in my field. Pharmacists across the country were dealing with this. Patients with type 2 diabetes on Ozempic for years were suddenly calling around town because their regular pharmacy was out. Some had to switch to medications they had never taken before.
So Novo Nordisk made a decision. Same active ingredient, same molecule, but now officially approved for weight management under a new name. Wegovy. One scientific discovery. 2 drugs. Millions of lives changed.
So here's the answer I promised. The reason Ozempic works has nothing to do with weight loss and nothing to do with a trend. It's a hormone your own body already had a blueprint for.
It's a 4-minute hormone, and a desert lizard that rewrote modern medicine.
What do you think GLP-1 drugs will be used for next? Drop your guess in the comments. I read everyone. Subscribe if you want to see where I take this next. There is a lot more to unpack.